sepsis is not uncommon, it's severely ill, and a third generation cephalosporin is indicated when suspected. If there is that sepsis, means that there's bacterial toxicity in the blood. So what should we give? We should give a cephalosporin, third generation cephalosporin. Okay. So these are some of the antibiotics. Just remember, chloramphenicol, third generation cephalosporin are useful for uncomplicated gastroenteritis. Okay, but most of the time, non-complicated diarrhea, we don't need any antibiotic. Okay, so we stop share and we go to our tutorial. The tutorial class today is define gastroenteritis. What is gastroenteritis? Gastroenteritis is the infection of the gastrointestinal tract. Discuss about prevalence of gastroenteritis. You must know about what organism is prevalent in Malaysia and what is the percentage. Most of them are E. coli, which come from the GI tract, or can be salmonella, or can be usually salmonella typhi or paratyphi, or the normal ones such as Shigella, which can cause non-complicated diarrhea or can give rise to bloody diarrhea. Then must talk about cause of gastroenteritis. Cause of gastroenteritis come from the organism through infection. How does the infection occur? Usually due to the fecal oral route. So it's from the food that we eat, enter our intestine and come out from our how you excrete the product. So there must be a fecal oral route, and once there's a fecal oral route, there will be a carrier. Then after that, you need to talk about structure of stomach, duodenum, jejunum, ileum, and cecum, because these are the areas where there are commensal organisms. Commensal organisms are good bacteria that protect our stomach from invasion of toxic or infective microorganisms. That's why one of the drugs that currently we use are called probiotics. Probiotics are microorganisms that work as commensal in our body. Then we need to talk about function of the stomach and intestine with peristalsis process. Why? Because peristalsis process is the one that allows the food to navigate from our mouth to our anus. So this peristalsis process, if it becomes quickened, you can give rise to diarrhea. And diarrhea, there are normal diarrhea, known as uncomplicated diarrhea and bloody diarrhea. Then we need to talk about virulence of microbe in gastroenteritis. What is the microbe which is virulence? What is the factor that make them able to cause disease? Virulence is the ability of the organism to cause disease. Then discuss the pathogenesis of gastroenteritis. So how is the cause? How does the organism attack the stomach and the gastrointestinal tract? Then you talk about pathophysiology. How does the organism change the physiology function of the gastrointestinal tract from normal to abnormal physiological function? This how does it give rise to diarrhea and bloody diarrhea? And then discuss about drug used for gastroenteritis. The drug that used for gastroenteritis, I said chloramphenicol, third generation cephalosporin, and fluoroquinolone. And then you discuss about alternative treatment. So alternative treatment for gastroenteritis can be oral rehydration solution. Or other than that, we can even give them, in the area where medicine is not available, can let the patient drink what we say 100 plus as a replacement for oral rehydration solution. Then discuss about prevention of gastroenteritis. How do you prevent gastroenteritis? You prevent gastroenteritis first by keeping proper hygiene. It means you wash your hand every time you go to the toilet and make sure your hands are clean before you take your food. And you must make sure you live in a hygienic condition, and then must make sure that there is a health education for the younger generation, and also the elderly about gastroenteritis by putting poster, putting show in the TV. And another one is that you need to disseminate the information to as many of the people as possible. And lastly, you should also build up a very hygiene area for the patient, means that you have proper water and sanitation, because all these organisms spread from either fecal oral to water or food as their format. And also to detect any carrier and then to what we say to clear the carrier of infection. Okay. Any question, Otto?
No question from me, doctor.
What?
No question.
No question. I think you should be asking every time you ask, there'll be better, so all of us can share. Because I think this is direct, correct? About only then you need to finish this.
Yes, doctor.
You must know that. Okay, I will tell you important. What is the important question in this exam? Usually they will come out in the final. Usually will be first one question will be on gastroenteritis. One question will be on peptic ulcer. Then one question will be on cancer. And what is the most common cancer in the GI tract? The most common cancer in the GI tract is colon cancer. Okay. Then another one will be infection. So you can see infection can only be two. One is gastroenteritis. The other one is a hepatitis infection. Hepatitis infection that affect the liver. So you must know about what is the drug used for hepatitis. This one we'll cover later on. And you must know also about what antibiotic what antiviral is used for hepatitis, number one. Number two, you must know about what is the hepatoprotection. What type of drug can protect against the liver, such as Legalon. Legalon is one of the herbs that can protect the liver from fatty liver or viral infection. Okay. Can you all finish this assignment? I give you all need within 1 week's time, if possible. Akhil, anything else you want to ask? Anything not?
No,
so at least we know about the important one. Okay. Then the drug when you talk about the drug, make sure that you need, when you talk about the drug for gastroenteritis, you need to talk about two important things. One is the mode of action of the drug, and the other one is the side effect.
okay, doctor.
Okay, sure. So I see you all next week, okay? And good luck for your exam for test 2. Any question to ask me for test 2? Test 2 will cover my topic of anti-emesis, GIT infection, and peptic ulcer disease. Okay? So make sure that you all read for test 2. Test 2 will only be MCQ and single best answer. Anything else?
No, doctor.
Okay, sure. So, no, thank you for coming for class. I see you all next week. Then you all make sure to finish your assignment, okay?